So you've been diagnosed with fibromyalgia. What exactly does that mean? And really, where do you go from there? Hang on, I'm going to explain that in just a moment.
Dr. Mark Dailey is president and CEO of Birmingham Functional Medicine, founder of Fibromyalgia University, a certified functional medicine practitioner, and a nutritional counselor with advanced education in functional endocrinology, functional blood chemistry, the brain and neurotransmitters, and thyroid function. With over 25 years in clinical practice, he focuses on chronic conditions like fibromyalgia, chronic fatigue syndrome, irritable bowel syndrome, as well as autoimmune conditions. Let me introduce Dr. Mark Dailey.
Does it really matter that you've been diagnosed with fibromyalgia? And where do you go from here? So without a diagnosis, which is basically a label for your health condition, there's not much traditional medicine can do for you. And this is where functional medicine and traditional medicine differ. This is very important if you're trying to restore health and normal function to your body. Of course, we tend to feel more in control if we have the name for what we're suffering from, but that is not always possible. Doctors really need to think outside the box. We all need to see beyond the limitations of a label. So don't get hung up on a diagnosis. Instead, learn to understand what causes the health issue and how to improve it or reverse it. Spend more time and effort learning the interrelationships of various body systems and how they lead to dysfunction and disease. Healthcare should not be a narrow system of linking to a diagnosis or linking a drug to a diagnosis. So if you were diagnosed with fibromyalgia, now the doctor may look at the list of, well, what do we prescribe for fibromyalgia? Well, you may have Lyrica, Zymbalta, gabapentin, and other drugs. Some of them were intended for seizures. Some of them are neurological agents. So the point is, you say, I've got fibromyalgia. They look at their list of drugs that are given for fibromyalgia. And if you've had fibromyalgia and you've been on some of those drugs, you know that they really don't work. They don't make a big difference, and some actually make you worse. So many of the new patients that come to me for help have not been able to get a diagnosis from their doctor or their specialist. And like I said before, without a diagnosis, you probably won't get much, if any, help from your primary care physician. Then there's what I call the useless diagnosis. And this is when you get a name for your health issue, but it doesn't help you resolve your health problem because doctors don't know what causes it, or may have several different root causes which are not assessed or addressed. So these conditions require further investigation to isolate the root cause. And this is the kind of investigation that functional medicine doctors specialize in. So let's consider a couple of useless diagnoses. IBS is irritable bowel syndrome. Now, the name itself should tell you that doctors don't know what causes it. Your bowels are just irritable. You might be given some sort of antidepressant, or if you're lucky, maybe even told to change your diet. The most common diet recommendations by gastroenterologists would be a low FODMAP diet. That's FODMAP diet. And there are certain carbohydrates, sugar, starches, and fibers in foods that you basically avoid. Yeah, this diet does help some people, but the question still remains, why did the person suddenly lose the ability to digest certain types of carbohydrates? Many times this loss of digestion function is due to loss of function in the small intestines. Now, the small intestines is where absorption takes place. The brush borders of the intestinal lining are the site of terminal carbohydrate digestion. And the microvilli, which constitutes the brush borders, have enzymes for this final part of digestion. These enzymes are found near to the transporters that will then allow absorption of the digested nutrient. So it turns out that many cases of IBS are really caused by dysfunction or damage to the small intestine. This is the same part of the digestive system where other common disorders occur, like leaky gut syndrome and small intestinal bacterial overgrowth. You can't see these conditions with a colonoscopy because they're microscopic. Now, some patients may be given some type of drug that changes their neurotransmitters, usually some sort of antidepressant. It is not uncommon for the digestive system problems to be associated with neurological or neurotransmitter imbalances. For example, many patients with IBS also suffer from anxiety. Now, I tell you what, I would be anxious too if I was driving from my home to my school or to my work and wasn't sure if I was going to have a very serious, urgent bout of diarrhea. There are a lot of common connections, however, between the gut function and the brain. Many patients find that their anxiety improves when their digestive system function improves. So as a functional medicine doctor, a diagnosis of IBS doesn't mean much to me. I'm interested in discovering why IBS is occurring. Common causes are food sensitivities, immune system reactions to foods, which is not based on the low FODMAP diet, leaky gut, small intestinal bacterial overgrowth, and the balance of good and bad bacteria, yeast overgrowth, which is a fungal overgrowth, and the chemicals that they're producing cause trouble. So I am also extremely interested in the connection between the brain and the gut. So if the patient also suffers with fatigue, brain fog, insomnia, then I know that both the gut and the brain are being affected and need to be addressed. So now let's talk about fibromyalgia. This is often just used as a diagnosis when you have lots of body-wide pain that can't be found, where the cause can't be found. And this condition is usually treated by traditional medicine, as I mentioned, with drugs that reduce inflammation or alter neurotransmitters in the body. Officially, fibromyalgia is a disorder characterized by widespread musculoskeletal pain accompanied by fatigue, sleep, memory, and mood issues. Researchers believe that fibromyalgia amplifies pain sensation by affecting the way your brain processes pain signals. Now, fibromyalgia also often coexists with other conditions like IBS, which we just mentioned, migraines and other headaches, interstitial cystitis, which is an autoimmune-related condition. And there are other autoimmunities that are in strong correlation with fibromyalgia. Now get this. I know this may be hard to understand, and I don't want to downplay fibromyalgia. God knows I've spent the last 15 years of my life trying to help people struggling with fibromyalgia. But from a functional medicine perspective, we often find that the digestive system, the nervous system, and the immune system can be involved in fibromyalgia. These different systems need to be evaluated in order to determine their relative contribution to the disorder. It also turns out that these three systems are interrelated and strongly influence each other. So it's almost like dominoes. One can knock the other off kilter. So a diagnosis of fibromyalgia does not tell you anything about why you have these conditions. It simply describes what you are feeling. This problem, or the problem, is that traditional medicine only focuses on reducing your symptoms. And of course, in fibromyalgia, one of the main complaints is body-wide pain, fatigue, and brain fog. So there is no investigation into these systems that are struggling and not working properly. So and of course, causing the discomfort and other symptoms that you may be experiencing, like fatigue, digestive problems, insomnia, brain fog, and changes in mood. So this is definitely a big issue, and my answer is continue to ask why. Maybe you have a diagnosis and maybe you don't. In functional medicine, we are, of course, interested in the diagnosis, but sometimes a diagnosis isn't enough and isn't possible. So a diagnosis is simply the beginning of the healing process in functional medicine, and it's the end of the healing process in traditional medicine. So as a functional medicine doctor, I'm looking for the root causes of the health problems. I keep asking why and looking for answers that lead to solutions. Causes that we can focus on correcting, identifying, and improve or reverse root causes. And of course, the byproduct is that health returns. You feel better and your quality of life improves. So the purpose of functional medicine is understanding how the body works, knowing how and where to investigate health issues, knowing what to look for, understanding the significance of what is found, and creating a plan of action to actually reverse and correct the root cause of your health problem. So if this has been helpful, please like the video so that other people can find it. Please subscribe to the channel. We put out new videos frequently. We shoot for once a week. I don't always reach that ideal. And if I can be of any help to you, we'll leave our contact information. I do offer, for those of you who qualify, a free initial consultation. So you're welcome to take advantage of that. But thank you so much for your time and attention. God bless you and have a great day.
If you are struggling with a chronic condition and would like more information, feel free to visit www.birminghamfunctionalmedicine.com. You are also welcome to set up a phone or Zoom consultation with Dr. Dailey at www.talktodrd.com.